here with Ashley Conway. I'm Jennifer Miller with Dysautonomia Support Network, and she's a licensed clinical therapist in the state of Florida. Thank you for joining us today.
Thank you so much for having me. Happy to be here.
Thank you. Well, we want to discuss the importance of mental health therapy along with living with a chronic illness, most specifically dysautonomia. You're a patient yourself, as well as a mental health therapist. Can you tell us a little bit about your story?
Yeah, so I was diagnosed with POTS in 2021, but my symptoms really started in 2020. I was in grad school to go back to school to become a therapist, doing a master's program. So lots of stress going on. As we know, COVID was happening at the same time. Um, and one day I stood up too fast and fainted. Thought nothing really of it, kept going. And 3 days later, I was collapsing on a table, fainting. And fast forward, went to hundreds of doctors, it felt like at the time, to get the diagnosis of POTS. And it was devastating. I was in the middle of grad school trying to finish, thought that that wasn't going to happen anymore for me. A lot of things that I had envisioned at the time were all sort of dreams that I didn't think were going to be reality anymore. I think we were all feeling really isolated during that time, and that just sort of added to that as well. So now I did get my master's degree, and I work with clients who also have POTS or other chronic illnesses. And it's been great because I think I can bring a lot of empathy and compassion with my approach with clients that other providers may not have by having that same lived experience. So,
Right. Well, that's amazing you were able to still complete your master's. How has being a patient affected the way you approach patients coming to your practice?
yeah, so being a patient myself, I think it gives me a little bit different a perspective, right? So when someone's saying they're so tired and not getting out of bed every day, I'm not automatically jumping to, is this person depressed? I'm looking at their physical symptoms as well, and sort of same thing with anxiety, which is coming first, our high heart rate, walking into that grocery store, or the anxiety about even going into a grocery store. So it's sort of interesting having my own experience. I'm able to pick up on these sort of nuanced things that I don't think a lot of providers who haven't experienced that may pick up on those things as well.
Right. Those are definitely good points. A lot of the patients in our community I know are socially isolated. Some are homebound, and it seems quite common that there's social anxiety as well as the longer the patients have been isolated at home. Can you describe your experience working with patients who have chronic illnesses?
Yeah, so my clinical experience first actually started working with veterans. A lot of them had long-term disabilities from injuries or maybe PTSD, things like that. So I started really doing a lot of grief work. And that was when I was getting my master's degree. I was still working with the VA. And then when I got diagnosed myself, I sort of felt that grief and isolation and the emotional toll that all of this was taking on me. And I was able to use that grief work in my own practice, then joined a group practice, starting to work with a lot of autoimmune disorders as well as POTS. And it was weird that clients were just sort of coming to me, and I was able to work really well with that group. So it was just sort of started out not where I thought with veterans and ended up here, but really took my own experience to sort of drive that too. And yeah, it's been great.
That's great. How do you tailor mental health support for patients facing long-term physical health challenges?
So I think for long-term challenges, we're looking through a different lens than traditional therapy. So being really flexible and responsive to the client's illness. And what does that look like? Maybe it's the client can only do virtual sessions. They're not able to come in and to do therapy. Maybe it means that we're pacing the sessions for what their cognitive load may look like for that day. How many spoons do they have? So to say, are we going to go into trauma that day, or are we going to focus on just emotional regulating that day? Kind of tailoring it for the client more than I would without someone without those health challenges. But I think it's important to be really realistic and energy conscious, right? When we're setting goals with that type of client, and avoid triggering the physical symptoms by pushing on trauma or going too fast, really pacing it based on their needs. And of course, focusing a lot on validating their experience. I think that this is so important, and just validating what they're going through as well as the fears that are coming because of it, you know?
Right, definitely.
Yeah.
How do you approach the overlap of physical symptoms and psychological distress, such as fatigue, pain, depression?
So I want to normalize how fatigue, pain, anxiety, depression are interconnected at times, a lot of the times. So if someone has chronic pain or chronic fatigue, that may be generating anxiety. Like, I can't go to work, I can't do these things, I'm in too much pain. It might cause them to go into depression, which when they're in that anxiety or depression, their trauma responses are sort of coming up to the surface then. So we're addressing those also. Those trauma responses in themselves can just exacerbate whatever physical symptoms the client is also having. So in my work with clients, it's important to help them discover what their cycle of that is too, and sort of once we identify the cycle, it's easier to use tools to help them regulate it as much as they can through that too.
Right. What therapeutic modalities do you use in your practice?
So I use a mix of CBT, EMDR, and mindfulness. And so I know a lot of people might not know what those are. So CBT is cognitive behavioral therapy, and we're really using that to reframe maybe some of the negative thoughts. So maybe that's if we talk about having anxiety about going into the grocery store, starting to reframe the thoughts. Maybe not every thought you have is a fact. I know myself, I thought I was going to die going into a grocery store. That's not a fact. It was a real possibility that I might faint, right? But sort of reframing in my mind, okay, what can I do? What is true? And what's in my mind making more anxiety before I even get to the actual event itself. Of course, there's ways you can also prepare for that in general too, but CBT is good for that aspect of reframing some of the negative thoughts. EMDR, which uses eye movement, or we can do bilateral tapping if it's virtually done, that can really help with trauma. And so for a lot of chronic illness patients, medical trauma, right? Maybe they get severe anxiety just going into the doctor at this point. We can use EMDR to bring that down a lot, and help with any sort of trauma like that as well. I've seen it be really successful for eliminating that piece that can be contributing as well. And then just the other thing I use is mindfulness activities, which people think, oh, deep breathing, oh, this, but it's all in conjunction, right? So I use all of those in conjunction as part of my medical model to help clients. And the mindfulness piece, whether it's meditation or grounding, things like that, those are things that clients can do outside of the therapy. We only get so much time in therapy. So ways they can start to learn to, regulate their nervous system for what they can on their own as well.
Right. Many of the patients are grieving their life, that they had dreamed of having. Can you describe the cycle of grief and how you support patients in managing the grief and identity shifts that come with chronic illness?
That's a great question. Like I said, I did a lot of grief work before I even got the chronic illness myself. And then I started realizing, wow, what an overlap this is. This is just continuous grief work, really. We're grieving many things. So, like the loss of the identity we thought we might have, relationships, careers, future plans, all of these things. Each one of those is a grieving process in itself. So, what I use with my clients is sort of a dual process model where we're examining the grief and all the stages that they're going through, but we're also creating a model for the adaptation of that grief in a new life with new meaning and new goals, new ideas. So they're both happening at the same time. But the grief cycle itself denial, anger, bargaining, depression, acceptance, a lot of people think that's a straight line and I should come to this place of acceptance eventually. But in my experience working with grief, all those stages bounce around and they'll bounce around for many, many years. We'll think we'll come to the place of accepting, and then wham, we're back at denial or anger, and that's okay. So validating all of that for wherever you are in the cycle is part of my job in supporting clients, but also reminding them that we can create a new meaning out of this too. It may not be what you envision, but what can we explore together that are your strengths to try and help you like build upon that as well.
Yeah, that's good. Um, can you give an example of a successful treatment plan that you've seen with a chronic illness patient?
Yes. So this was actually sort of similar to my own experience, but I can speak of a younger client I had who thought they were going to go to college and got a POTS diagnosis before they even got there. They had to take a year off because they were completely bedbound at the time. So that not only brought them into a deep depression, but it brought up memories of like severe trauma and grief over losing this independence they thought they were going to have. They felt really dismissed by their providers. That was something we talked about a lot. Isolated socially, unsure how to move forward. We worked for several months using EMDR as far as the medical aspect of this because they should have been diagnosed way further along and were denied by many providers and told they had anxiety the whole time. So, that was very invalidating for them. So, doing the EMDR for that piece was very successful. And then we kind of explored their values to redefine what their purpose was going to look like now within their limits. And used a lot of pacing in the sessions for what they could handle. And I think that was key to getting them to continue in therapy. But one of their biggest breakthroughs was helping them shift from I have to get back to who I used to be to I can build something meaningful now. I think that that's a really big shift that they had, and a lot of us have to have to create that new meaning. We can't keep looking back. We create a new forward. So this client eventually went online academically, was able to go to school full time through that route. They got peer support online. So thank goodness we're able to do things virtually. And then they saw themselves for more than just the diagnosis, but that took a lot of time to get them there. So it wasn't about being cured or symptom free, but again, finding the new hope within those limitations that they have.
Yeah, that's great. How do you help patients maintain motivation and hope during flare-ups or as a disease progresses?
I know it's really hard to have hope during the flare-ups. I don't like them either. So shifting again, some of this from outcome focused. For example, like I'll go back to work full time to shift to like I'm going to have compassion for myself today. During a flare up, we need to have things that can increase our sense of control of the situation. So we talk about flare ups before the flare ups here, hopefully in therapy, and what makes you feel better during those and what can you do within your control. Maybe it's a little pack of things that's a little toolkit for you that we can talk about that during those moments those things bring you a sense of peace, they help calm you as much as they can. Again, it's not about curing you, but you finding your sense of control within what's happening to you as well. Also, just normalizing the fact that there's going to be flare ups, there's going to be setbacks. This is not, a straight line to healing either. Um, and a lot of us want to be perfectionists. So knowing that it's okay to take a day off, to be tired, to be in bed, and not shaming ourselves and feeling guilty for the things that we're missing during that time. Holding space for the grief of the things that we are missing. All of those are really, important to have the client be aware of and to hopefully give them hope that there's going to be better days also when we put it in perspective, like that.
Definitely. And I find there's quite a few patients in our community that are perfectionists and they have a really hard time, accepting that, during that flare up.
Yes. Yes, and that's a big part of it too, and not just the grief of it, but I hold myself to this standard, not just let alone what everyone else is holding me to.
Yeah, definitely. How do you address mental health needs when the patient is primarily focused on their physical symptoms?
So, I'm from the School of Social Work, clinical social work, and the biggest emphasis is meet the client where they're at. So, if they're concerned about their physical symptoms, that actually makes a lot of sense to me because that's how I was, right in the beginning. You're so concentrated on, can I get better? What can I do? Is there a cure? Help me, get out of this. I think first normalizing their focus on their symptoms because it makes sense. A lot of those might be rooted in fear, right? Fear of what if I don't get better? Fear of maybe trauma that's happened on the way to getting that diagnosis, like I talked about. So just normalizing it and then kind of gently introducing the themes of anxiety around a flare up or anxiety when you go to the doctor as they're talking about their physical symptoms. The more that we sort of build that connection in therapy, it sort of allows me to sort of interweave that in to get them to think more about the mental aspect, not just the physical symptoms. Um, Over time, this can kind of like create a bridge between the physical symptoms and the emotional processing. But we have to build that trust to really get to those deeper layers too.
Right. Well, how do you assess for depression and anxiety when the symptoms are overlapping with a physical illness?
That's tough sometimes for sure. And I kind of mentioned that in the beginning. I think having my own insight helps, right? Because I can kind of ask maybe some of the questions I know from my own experience, but really focusing on the emotional and cognitive symptoms at first. So, are they feeling hopelessness? Are they feeling a lot of guilt? Are they feeling lack of motivation? There is scoring, from PHQ-9 or anxiety that can give us a score if the person has anxiety or depressed, but asking some of these more nuanced questions in conjunction with that, I think is very important when screening for either of those. And then just kind of asking the client about shifts in their own baseline. What's been going on with you? Did they just go on a vacation? Did a major emotional event just happen that maybe they're not picking up on, but I, as a therapist, can connect some of those things. So it is a little bit more nuanced, I think, in diagnosing for sure.
Right. And how often do you reassess treatment goals with the patients?
So goals are really fluid, at least with me. I'm very client centered, so I want to create these goals with the client. But as far as reviewing the goals, formally, we do it every 2 to 3 months, but informally, I'm really doing it every session. So if I gave you something last session we talked about doing, I will be checking in sort of, is this still working for you? And I'm very open to yes, this is, or no, that's awful. Let's try something else and move along. But my biggest thing is that flexible treatment equals sustainable treatment. It needs to be flexible and really tailored to what the client wants to do, you know? Um, and it could be different all the time. Maybe we're working sometimes on emotional regulation, and then the person's having a flare up and not able to do certain things, and that's okay. And we can just shift the treatment as needed. So, like I said, that's kind of fluid for me of how to approach that.
That's great. Well, speaking of coping and resilience, what strategies do you use to help patients build resilience and manage the uncertainty?
That's a great question. So resilience in chronic illness, I don't believe is about pushing through. I believe it's about learning how to adapt, regulate, and reframe things, even though there's this uncertainty going on. So, like I said, first biggest thing for me is validating their experience. I get that you're going through this and it's awful, it's bad. Let's talk about it. And then working to identify what are their internal strengths. What maybe aren't they picking up on that I can help them see in the session, and we can build upon those strengths together, while also building coping skills, whether that's some of the mindfulness things we talked about, and exploring what their values are, what can also help drive this change for them in being resilient. What do they value? But normalizing the uncertainty of it is really important, and that the resilience isn't about avoiding a hard day. It's about knowing how to take care of yourself through those hard days. I think it's really important.
How do you work with caregivers or family members to support the patient's mental health? Because with this illness, we rely on our caregivers and family members for that support.
Yes, yes, and that's great. I think having a support system is obviously so helpful. So I don't know, I know it's very difficult for those who may not have that system, but how the system supports the person really matters. So I've worked with caregivers to talk about not just educating them on the illness and maybe why the person is acting this way based on where they're at the moment, but the emotional toll that the client, the person with the illness, is having, and validating for the caregiver the emotional toll it's probably taking on them as well. That's important too. But supporting the caregiver and expressing the needs back to the client, but also allowing them to have boundaries. So I think that's something also we talk a lot about in therapy, and people don't want to have boundaries with their caregivers at times, or vice versa. The caregiver may not know when to say no or take a break for themselves. It's all about putting that oxygen mask on first sometimes before they can keep helping more. But the biggest thing is also for the caregivers to not become fixers, but to really just be able to hear what's going on and be a support. And I think sometimes that shift needs to happen as well with the caregivers. And like I said, we've all been invalidated in a lot of ways. So just feeling heard by the caregiver who may not fully understand, but not trying to fix it while doing that, I think can be really helpful.
Those are really important points. What do you think is the most misunderstood aspect of mental health in chronic illness care?
There's a lot of misunderstood aspects, I think, but because we're talking about this, so the belief really that the symptoms are just psychological, or that they're psychosomatic or all in your head, especially as women. I know that there's a lot of us who have been told we have anxiety and we don't. And there's misdiagnosis of being properly diagnosed because of that. I also think that there's a misconception in therapy that it's just coping better. And I really want to emphasize today that you can do more than just cope better in therapy. It can help identify trauma, it can help you bring a new meaning, and it's not just about relieving the symptoms. It's not a substitute for medical treatment, but it can complement the medical treatment when we work hand in hand like that at the same time.
What kind of support or resources do you recommend outside of therapy?
I think support groups are great. So doing your own individual therapy. I know you guys have a monthly support group, which was great as well. But I'm sure there's other locally, at least where I live in Palm Beach County, there's local support groups for people with maybe not specifically dysautonomia, but chronic illness, other autoimmune groups. I would recommend joining that as well as doing your own therapy. Also, getting the caregivers into therapy is extremely helpful. So then we're looking at the whole component of your where you're at. And there's a lot of apps that are great. So I like Clue, the app for mood management, specifically for women, and you can track how that relates to your cycle. I know a lot of people with POTS, we might have flare-ups around that time, so it's a really great app to use. Also, just free YouTube guided meditations have been great for a lot of my clients. And there's also like Insight Timer or Curable, other apps like that I've heard of clients using that have been helpful for them specifically.
That's great. I'll have to check those out. And then, like you mentioned, we do offer monthly virtual support group meetings on the fourth Thursday of each month, 7:30 p.m. Eastern Time. You can find the registration link for that on our website under the events tab. I think we appreciate your time today, Ashley, and the validation you've given the patients of our community, and just how important it is to seek therapy as part of their treatment plan. If you're located in the state of Florida, we'll attach Ashley's information at the end of this video so you can be in contact with her and receive some treatment from someone who really understands.
Thank you so much, Jennifer. Thank you for having me.
Yes, thank you for being with us. We appreciate it.